Trinidad and Tobago is in the midst of its third COVID-19 wave, with the circulation of the P1 or Brazilian strain, which we have seen causes even more illness and death. Since April 2021, the Ministry of Health has been offering Astrazeneca or Sinopharm vaccines to segments of the general public. Yet many remain reluctant to be vaccinated. The reasons for this vaccine hesitancy are many, including the circulation of misinformation on vaccines in general and COVID-19 vaccines in particular. In response, the Health, Safety and Environment Committee of the Archdiocese of Port of Spain has produced this short podcast to provide background information on vaccines and their effect on the immune system, on the Astrazeneca and Sinopharm vaccines in particular, and especially their real-world experience in preventing death and hospitalization. We hope this podcast will help you to make a more informed decision and that you will avail of the opportunity to be vaccinated when it becomes available to you. Vaccines are formulated to show your immune system important parts of the virus. In the case of the SARS-CoV-2 virus, many of the vaccines show the spike protein of this virus to the immune system. The spike protein is the part that the SARS-CoV-2 virus uses to infect cells in our bodies and cause COVID-19. When this spike protein is shown to the immune system, we develop antibodies to it, and the antibodies prevent the virus from being able to enter and infect cells. The Sinopharm vaccine uses a killed SARS-CoV-2 virus, which is unable to cause infection. The Astrazeneca uses another virus like a taxi to deliver the blueprint for the spike protein into cells into our bodies. Both the Sinopharm and the Astrazeneca vaccines stimulate the immune system so that the immune system is prepared even before it meets the live COVID-19 virus. The virus used in the Astrazeneca vaccine is what we call a non-replicating adenovirus. It cannot cause illness. It's important to know that Sinopharm and AstraZeneca vaccines do not and cannot give you COVID-19. The immune system is a very complex system, and like any excellent defense force, it has many parts which can attack the enemy in different ways. When COVID-19 vaccines are used, they stimulate a response that is specific for the part or parts of the SARS-CoV-2 virus, the virus that causes COVID-19 infection. The vaccines stimulate B cells to make antibodies, and these prevent the spike protein of the virus from helping the virus enter cells. The vaccine also stimulates different kinds of T cells, and one kind of T cells, called killer T cells, will kill any cell that is infected with the SARS-CoV-2 virus. Most importantly, vaccines stimulate immune memory so that the immune system remembers the virus or parts of the virus that it met in the vaccine. So should it encounter the live virus, then the immune system works faster to try to quell the virus from causing infection. And that's why if you do get infection post-vaccination, it is usually asymptomatic or mild. The World Health Organization has provided emergency use authorization for several different types of vaccines. These different vaccines work in different ways and include the mRNA vaccines such as the Pfizer and the Moderna, the viral vector vaccines such as the AstraZeneca and Johnson & Johnson, and the inactivated virus vaccines such as the Sinopharm and Sinovac. All of these vaccines have received the emergency use authorization because they are able to stimulate good immune responses in vaccinated people and provide protection against the SARS-CoV-2 virus. So is it safer to get immunity from COVID-19 infection or vaccination. Like all medical interventions or medications, vaccines can have side effects. They commonly cause flu-like symptoms and local reactions at the site of injection. Very rarely, they can cause more serious side effects. In the case of Astrazeneca, it was discovered that there was a rare occurrence of blood clots. Anywhere between 1 per 60,000 to 90,000 people vaccinated could develop blood clots. Fortunately, if a person develops symptoms of a clot post-vaccination, there are simple laboratory screening tests to determine if the person does have the vaccine-induced clotting problem, and there are treatments available to deal with this problem. As with everything in medicine, we have to assess the risk of the treatment versus the risk of disease. And as this graph shows, clotting that develops when one gets COVID-19 is many-fold more common than should you get the Astrazeneca or other vaccines. So the data suggests that taking the Astrazeneca is still far safer than getting COVID-19. We now have many examples in the world on the success of COVID-19 vaccination programs in many countries. Simply put, infections fall as vaccinations increase. For example, in the USA, there were over 251,000 new cases on January the 9th of this year. The USA started its vaccination program in December of last year. Almost 6 months later, on the 27th of June of this year, there were, in fact, 4,165 new cases. That is down from over 251,000 on the 9th of January. That is a drop of over 98%. Similarly, in keeping with the large decrease in the number of new cases, there has been a huge drop in the daily number of deaths in the United States. On June the 25th, there were fewer than 500 deaths in all of the USA. Unfortunately, most of the hospitalization and deaths now seen are among those who have chosen not to be vaccinated. So how good are the Astrazeneca and Sinopharm vaccines that we are using? We have more news on the Astrazeneca largely because it has been used widely in the United Kingdom and they have excellent monitoring systems. It's very effective in preventing symptomatic infections and even more so in preventing hospitalizations and deaths. This means that if you have received the 2 doses of Astrazeneca, that you are 90% less likely to develop symptomatic COVID-19. There are less data available for Sinopharm, but this Seychelles experience is definitely more positive than was suggested by some Western media. In the Seychelles, only the Astrazeneca and Sinopharm were used, with 60% of those vaccinated receiving the Sinopharm and 40% the Astrazeneca. The information presented on this slide is from the Ministry of Health of the Seychelles at the end of May 2021. And this shows that while there were infections among those who were vaccinated, that these were asymptomatic or mild, and that the vaccines are protected against hospitalization, so that most of the admissions were among those who were unvaccinated. Almost all critical cases were among those who were unvaccinated, and none of the people who died had been fully vaccinated. The more of us who get vaccinated, well, then we begin to develop herd immunity. When this happens, COVID-19 infection won't be able to spread easily, and the whole community stays safe. Even those whose immune systems are weakened and those who cannot be vaccinated. So again, I urge all people who are eligible for vaccines to get vaccinated. Getting a COVID-19 vaccine is good for you and also for those around you. Currently, the vaccines we have been getting and are likely to get in the near future are those for adults. There's evidence that when the majority of adults in a community are vaccinated, that there's less spread of the virus among children and they are protected. Therefore, the more adults we can vaccinate, the more readily we'll be able to open our schools and allow our kids to get back to normal education and other activities that we enjoyed in our youth. Pope Francis is very clear in his message to all Catholics. He has seen taking the vaccine as a moral obligation and stresses that it's not only about your life, but also the lives of others. We are all our brother's keepers. Thank you for your attention.